Hello, so today we're going to demonstrate our tabletop sim. So over here we created a pediatric rescue series, a fast and fragile pediatric inpatient SVT tabletop. So a tabletop is something you can do with a group of nurses, doctors, at anywhere, and you just have to open up your computer and tablet and even a auxiliary monitor. For today's demo, we only have one monitor recorded, but this can be spread out among 3 monitors. So I'm going to pick here, and this here is going to tell me a little bit about the scenario, along with some evidence-based references. So all of our scenarios are linked to references, just to kind of give us some evidence to support our scenarios. So we have here our scenario modifiers, a little bit of background about the patient, 14 kilograms, tells you a little bit about the facilitator notes to recognize pediatric tachycardia concerning for SVT. Here is discussion mode. This is no requirement of extra hardware. You can do a hybrid tabletop with skills. This is what we're doing for our skills day, so I picked that. And I put the monitor up on the screen. So for here, I'm going to start with no monitor. Standard deteriorates after adenosine. You can pick other things. Family presence is actually using the actor tablet, which is also follows along with the scenario and gives somebody who wants to be an actor lines to read during the scenario. So I want to transition to step 1. Here is our pre-briefing, just telling everyone that simulation is what happens in Vegas stays in Vegas. Starts with your handoff, a little background, gives you a 2-year-old male, 14 kilograms, no known drug allergies, came to the ED, admitted to the pediatric floor for continued IV fluids. Has several episodes of vomiting, diarrhea today, but is more comfortable after fluids. So you're walking in as the nurse or the provider, and I am as the facilitator watching your actions. The nurse should introduce themselves and do an assessment. So on the assessment, if you can go over here, there's nothing on the bedside monitor, but they do an assessment, and they have the heart rate is rapid. So then they get a full set of vital signs, which, as you can see to the right on my tablet, I have the vital signs that pop up, heart rate, respiratory, quite fast. And at the bedside monitor, they get the same things. So as soon as they do a full set of vital signs, they'll see what they can do. They can also cycle a blood pressure. They can obtain a temperature right from the bedside tablet. They're going to assess the perfusion, and they're going to let their charge nurse know and request an EKG. So also put the patient on a bedside monitor. When you press that, you can flip over to the bedside monitor, and you can see that they are getting a strip with a full set of vital signs. Moving on to step 2, gives you a little bit more findings on the patient, and the team recognizes that there is abnormal persistent tachycardia, so they discuss it, and they want to obtain a 15-lead EKG. When they obtain it, it comes up with this, just a little algorithm where to put the leads on. For our skills day, we actually have them put the leads on the proper position, and when they're ready, I click show results, so then they can read this, neurocomplex tachycardia, discussing it as a team. And we discuss vagal maneuvers. On the right hand side here, as a facilitator, it gives me some prompting questions that I can ask. Since this is a tabletop sim, it takes on the role of very discussion focused. So, asking them what their immediate concerns are kind of helps prompt them along. Now, if they want to get a glucose, I can check this button here, which will instantly give them a glucose on theirs under lab values. and which we see is okay. So they'll discuss vagal maneuvers, even if they request to do it, they can. Family communicators are great. These are all optional, but very important parts of a simulation or a real life situation. So moving on, the EKG as facilitator, I know what they're seeing, and here I am getting more notes for me to kind of drive the communication. They're going to report to the provider, and the crash cart is coming to the bedside because we're going to prepare adenosine and verify that weight-based dosing. They want to make sure they have an IV. As they're doing this and talking through it, I'm just checking it off on my screen. So this is also helping me build a debrief. And they're just going through the different things. What I do want to bring up here is I'm going to bring up both monitors so you can kind of see, or not. Yeah, we're going to kind of see on their bedside monitor when they give that adenosine. You're going to see real-time pause in the heart rate. And then up, it's right back. So now we're going to move forward in the scenario. They can give a second dose if they want to, and it does the same thing. But because we programmed this one to needing cardioversion, we're going to move on to the area where the cardioversion is. This is a new feature that I programmed in recently, and it gave me a default cardioversion or a default defibrillator. What was happening is we would bring the defibrillator in, which is always the first thing you should do, is use the hardware you use on the floor for people to actually get to use it, get to play with it, get used to it, because in a lot of pediatric inpatient settings, we don't use the defibrillators all that often. So the more you get hands on it, the better off you are. And I'm going to switch over to the auxiliary monitor. And this is the defibrillator here. As you can see, it defaults to 120 joules. You can turn it down based on what you want for your joules. I can power it on. It tells me, of course, to apply defibrillator pads. So I see them put the pads on. I'm going to switch back over there. And you can see that right from this point, we are now seeing SVT on a monitor. We want to sync this because you never want to defibrillate an SVT. You want to cardiovert. And then we're going to charge it up. You can see it slowly charging. When it's ready, the shock is there. You hold it for 2 seconds, and then it shocks them. And then, as you can see now, that shock converted to sinus rhythm. And as you can see, it is good. So this is a third monitor for simulation, so they can kind of see it, they can kind of interact with it, and it gives them an opportunity to get their hands on something that they can kind of go through the process. Once they're done, as with all of our scenarios, we have some pearls light debriefing discussion. A lot of it is pretty similar. Over on the right hand side, topics to explore if missed. This is just scanning all the different steps. If there's anything that was missed, it helps us for remembering if there's something you want to discuss. Obviously, there's a lot of stuff in there because I jumped forward. And at the bottom, there's some important information to share with the team. And that's just talking over adenosine dosing, synchronized cardioversion dosing, and just a little bit about that to kind of move the debriefing along. So this has been an update on what I've been working on, and I continue to improve this. Hopefully you get a chance to try it when you see this, or if it comes across your feed. You can always reach out to me at jason@stepsinside2.com or info@stepsinside2.com. and look forward to hearing from you. All right, till next time. Bye.